we are here to discuss about general psychology. This particular program which we are going to discuss will be emphasizing on dynamics of human behavior. Well, the dynamics of human behavior will be dealt from the point of view of how you are going to deal in the hospital because of the changes which comes in the behavior of an individual. In the studio, we have with us Mrs. Raminder Kalra on my right hand side. She is one of the very senior faculty at Rajkumari Amrit Kaur College of Nursing, University of Delhi. She has a specialization in psychiatric nursing. We are very pleased to have you, Mrs. Raminder Kalra, with us. With this, I think let's just first clarify that what is general psychology. Mrs. Kalra, would you like to discuss about it?
If we see to the term psychology, it's a very familiar term to us. It's not something new. We say that yes, I can understand the psychology of another person. Psychology is made from two terms, that is psyche and soul. It is study of mind. Psychology is defined as the scientific study of behavior. Its subject matter includes behavioral processes that are observable, such as gesture, speech and psychological changes, and processes that can only be inferred as thought and dream. If we see to this definition, we say it is the study of behavior. Now, what is the behavior? Behavior is anything which an individual does. It is what we are doing, our action, gestures, the way we talk, not only what is observable but also our thoughts, our emotions, which cannot be observed as such. But the way we think, our emotions, they also constitute an important part of our behavior. And when we say it is observable, not that we just observe it once, but we have repeated observation based on which the certain inferences are drawn.
Well, this is very important concept. If you are clear about what is general psychology, which you have also learnt in your general nursing and midwifery training, let us review or revisit why general knowledge of this general psychology is important for you as nurses, because you know this that we are dealing with human beings, and when we are dealing with human beings, they have complex needs, and every individual will not be the same, will not behave in the similar manner, though they may be suffering from similar kind of disease. So you have to consider every human being as an individual with their different needs, different lifestyle, different bringing up. So that is why it is important for you as a nursing student to understand about general psychology and to utilize this knowledge effectively when you are working with the patients who are human beings. It is important for the nurse to understand behavior, motives and experiences. When we talk of behavior of an individual, suppose a patient who has come with myocardial infarction is very depressed. Now, you don't have to say that why are you so upset, it is all right, so many patients suffer from disease, but this particular patient is very different and he may be depressed, the other patient may not be depressed. Similarly, the motives, what are the motives, which we will be talking in a short while, and experiences of the individual. As a nurse, we need to understand that. Also, you need to understand or predict the behavior and experiences of the patient, because the psychology will help you as a nurse that if a particular patient who is very upset or who is having pain in abdomen or missing his family members may cry. Now, this is prediction of the behavior of an individual, because you have learned from your experience while working with the patients that some type of patients would be there whose emotional stability may not be that very strong comparing to the other patients. That is why you will be able to predict the behavior. The other important thing is control behavior and experiences. You will be able to control your own behavior and because of experiences you have had. For example, sometimes you find a young patient who is suffering from a very a disease, a fatal disease. You try to empathize with the relatives and you also try to empathize with the patient because he is a young patient. So the patient suppose dies and you find that the other senior nurse is not available to help you in cardiopulmonary resuscitation to help this particular patient survive, and you get very angry right in the ward where there are patients and the relatives who are seeing, you know. So The knowledge of psychology will help you to control your own behavior and act appropriately when such a situation comes. The other important thing is that you will be able to relate with others in more effective and successful way. Now, for example, this particular patient who dies, his relatives start crying in the ward, and you say that I can understand you are very upset. It is very natural for you because you have lost a young relative of yours, but let me take you to some separate room. You sit there and then you take them to separate room and tell them, I brought you here because other patients are equally upset and they'll get more upset because the young boy has died. That is why I brought you here. Now your experience has helped you to understand the reaction of the patient's relatives, and you are also able to control your emotions but help the relatives to emote realistically because you had had such a kind of experience where you were able to control in a mature manner the behavior of the relatives. Now help the client or help the patient to cope with hospitalization. You know that hospital situation is a very stressful situation. The relatives are there who have left their home and job. The patient who is working or who is only the bread earner in the family is there on the bed and he is worried that what will happen to the children and to the family. So there are so many questions in the mind of the patient, and patient finds the hospital situation very stressful where the doctors and nurses are busy in handling the serious patient, in handling the patients who are crying, in sending the patient for surgery, the trolleys are moving, there is a noise. So this is a very stressful situation. That is why it is very important for nurse to give orientation to the patient, explain to the patient, explain to the relatives that what is important and why you are there in the hospital and how you will be able to cope up to the situation if you understand the routine of the hospital. And if the patient asks the questions to you, try to explain because this will give him or her a better coping abilities when the person is in the hospital. Help the client to cope with chronic illness. The other patients are recovering and going back, but this particular patient is not able to go back home, and this patient gets upset and starts crying, sister, when am I going to go, because everybody is going except me. And you may have to tell to the patient, see, you had come with the bleeding of abdomen, you were passing stool with the blood, you were having pain in abdomen, you had a bad ulcerative colitis which doctors diagnosed, now you are recovering, you are able to retain some food, you are able to take oral fluid and oral food. So maybe gradually when you recover up, you will be given discharge like the other patients have gone. The other patient's sickness was very different, they are put on treatment and they are discharged, but in your case you have to be put on observation. So remember that that empathetic ability we need to have, or you as nurses need to have when you are interacting with these patients. Also help clients to have compliance with the medical regime. Now this is very important again, because if the patient says, sister, you leave the medicine here near my bedside, which is a broad spectrum antibiotic, I'll take sometimes. You go at 11:13, you find the patient has not taken the medicine. So you have to explain to the patient, first is that do not leave the medicine next to the patient, and tell the patient, no, this is the time at 10 o'clock we need to give you this medicine, otherwise the effect of this medicine which is being circulated in your blood for 24 hours will not be there. That is why it is important for you to take the medicine at 10 o'clock. So these are very simple examples which we are sharing with you, but you can relate with the examples which you see in the ward and see that the knowledge of psychology will help you to understand the patients better. We were talking about dynamics of behavior, Mrs. Kalra. Now, how would you explain about dynamics of behavior?
Yeah, when we talk about the dynamics of behavior, dynamics is the change in the behavior. There are different components of behavior, like we talked earlier also. There are various factors which influence the behavior of a person. When we talk about our behavior, and sometimes we get really surprised, why did I get angry at a person? I never wanted to get angry. So there are certain motivation which direct the behavior. These motives may be conscious or at unconscious level that they work. Many times we are not able to understand why did the patient get angry. So in dynamics of behavior, we are going to learn about motivation, frustration, conflict, stress and stress management. First of all, let us see what is motivation. Motivation means to move, to energize or to activate. Now, psychologists restrict this term only to those activities that are motivated from within an organism. Not that this person has motivated me for doing this, but when we talk about motivation in psychology, we refer to more of the drives which are coming from within an organism. Like if I am drinking water, I feel thirsty. Thirst is the motive which makes me to drink water. If you have joined for BSc nursing after doing so many years of job, there has been some motive, maybe you wanted to achieve something in life. So those motives have made you to join this course.
Let us differentiate between three terms, that is need, motive and drive. Need is something, as you very rightly said, that if a person is thirsty, person drinks water. That means the need is satisfied. When we go to the drive, it is something which pushes you to achieve that particular thing. That means you walk and you take a glass of water and drink that glass of water, the thirst is satisfied. Whereas motive is something, as you very rightly said, internally energizes you to go and achieve that particular goal or particular object. So these are the three different terms: the need, drive and motive. These should be very clear in your mind, because many times they are used interchangeably.
When we see to this motivation cycle, there is a need within an organism. Need may be, as we said, it can be thirst, it can be hunger, or it can be that you want to achieve something in life. This drives a person to instrumental behavior. That means it makes you that I must go and seek for admission to BSc nursing, or if I am thirsty, I must look for the place where I can get water. Now this instrumental behavior will have you achieve the goal, and once the goal is achieved, a person gets relief. With that relief, one doesn't get satisfied. There are then other needs which come into, and this cyclic process keeps going on. You have one need satisfied, you start looking for another thing. You are satisfied with your hunger need, you start looking for that, let me get something good. Or you are satisfied, you have got your BSc degree, you might not be satisfied at that moment after getting BSc degree. You start thinking of, let me start working more and let me try to do even Master of Nursing then. So you have one or the other need which keeps motivating you to look for and to work hard. This is the motivation cycle.
Now there are certain typical characteristics of motivated behavior. Would you like to elaborate on that? Some of the characteristics maybe.
See, the the motivated behavior is like that one, they keep changing. Once you have a motive, then as soon as it is satisfied, you have another motive which comes into, and you try to go in for that particular motive.
Yes. Now, so one of the very important characteristics, Mrs. Kalra, is energy mobilization. Now, in this process, the individual tries to change the energy to achieve that particular motive. For example, the person wants to now, has had a glass of water or has had BSc nursing, as you were very rightly saying, but is wanting to do masters. Now when nurse wants to do masters, she tries to mobilize her energy by finding out what are the various resources, but by finding out that where she can apply, how she can go about and do the entrance test, and where she can get the admission. Now this is mobilizing the energy to see that the motivated behavior is achieved. Also persistence, that the individual starts persisting on achieving that particular motive, trying to see that that particular motive is fulfilled, and the motivation gets stronger because of that particular reason. Variability is another thing, that yes, I have tried this method, I scored say 40% marks or 50% marks. Now let me try another method, maybe I'll do a peer group study, or maybe I'll review my assignments, or let me use some library. So variability is the one which really again becomes, strengthens the motivated behavior, because that's, you are using various techniques for that, restlessness for attainment of goals, that oh, let me take my BSc nursing. Look, I'm now in third year or I'm in second year. After I complete my second year, once I have had a good knowledge of psychology, probably this will be a good base for me for the psychiatric nursing. So that kind of restlessness which is there, that again strengthens the motivated behavior. Similarly, once the goal is achieved, probably there is restfulness or extinction of that particular goal and one looks for another goal. Now these are some of the characteristics of a motivated behavior. There is nothing abnormal about it. Once one is motivated, one tries very hard. For example, it will be very funny for your children to see that you are studying at this age, and then you say, well that's all right, because I want to do my higher education, I want to know more about the program, I also want to see that I am able to understand my patients better, so I am doing higher education for that reason, like you are doing your after 8th 9th standard and after 9th the 10th standard. So this kind of persistence in your behavior is going to show that you have a motivated behavior of completing your program of post basic BSc nursing. Well, I think there are various theories which are discussed when we talk about motivation. One of the very common theories, homeostasis,
Yeah.
which has come from the physiology of homeostasis. Would you like to elaborate?
See, when we talk about the theory of homeostasis, this theory says that a person has a motive because to maintain physiological or environmental equilibrium. That means if we want to do something, it is because there is some imbalance in the body. You have some fluid and electrolyte imbalance, so you start looking for something to drink. Similarly, there is some environmental disequilibrium which motivates you to behave. But there is a criticism for this theory, that is that everything we are not doing to maintain the physiological balance. Like you have come and joined for BSc nursing. You were very comfortable with your job. It is not that you were not having job. You were very comfortable, but still you thought of going in for something where you could do better. It is that you are causing yourself, putting yourself in some disequilibrium, because you have to make so many adjustments in your job, at home. So this theory is criticized because of that. Then you have another theory, that is machine model, which says that it is the positive and negative reinforcement. Organism behaves because of environment. That means if you get some positive reinforcement, that behavior is strengthened, and if somebody gives negative reinforcement, that behavior is not done. Like a child, if the child sits for the first time and gets encouragement that yes, that's very good, you have attempted this, or when you start studying after such a long time and you get appreciation in the form of the rewards that you start getting, the marks that you start getting, or you have worked hard, you go to for the tutorials and the teacher appreciates you, are really having good knowledge, you are putting your practical knowledge also into the theoretical. So this acts as a reinforcement and you are more motivated to learn.
The other important, I think, is Maslow's hierarchy need, and in Maslow has mentioned that it is very important for an individual, whether patient or healthy individual, that their biological needs should be satisfied first. For example, the biological needs will be need for food, need for water, need for having oxygen, rest. Now, these are the basic biological needs, and even the sex, these are the basic needs. Now if these needs are satisfied, then the person can think for the higher needs. You see, if a patient is coming from the slums, and if the patient, you have served the food to the patient in the ward and is not satisfied with the amount of food you have served, well, the patient is going to ask you more, because the satiation or satisfaction has not occurred, because the patient was starving for so many days and patient wants to have so much of food. So you will have to give that amount of food to the patient to be satisfied, and then only the patient or individual thinks about the safety. That is the next higher level. The individual looks for first the biological need satisfaction. Once those needs are satisfied, then one looks for safety needs. Now what are these safety needs? This is need for security, need for comfort, need for freedom from fear, that you are not scared of anything, that need comes after your biological needs are satisfied. Because first the one wants to have enough of water, enough of oxygen, enough of food, and then later on thinks about the safety. This is the way Maslow has discussed about going higher and higher in the satisfaction need of the individual. The third is the attachment, that means need to belonging, that I belong to my family, this is my family who is looking after me, this is my family who will be there when I am in the hospital. So then one starts thinking about attachment, and this of course is affiliation to the loved ones and to be loved. So that is why biological needs are very important, and then comes the higher needs. See, higher needs are need of self-esteem, cognitive needs, aesthetic needs, self-actualization and transcendence. Now, transcendence is a spiritual need. Very few people will go for those kinds of needs if the other needs are satisfied. So that is why it is called as Maslow's hierarchy need, so that you are able to understand as a nursing student that how much the patient has recovered. Once patient has recovered, you will find patient gets up in the morning, goes for bath, comes back and sits on the bed and does meditation. Now that shows that the lower needs are satisfied and patient is trying to attend to his or higher needs. That's what it talks about, how the needs of the patients will change according to the satisfaction, according to the desires which are completed. The fourth theory or approach we talk is a cognitive approach. This approach deals with that the person tries to understand that this act of mine, where will it lead to? For example, the nurse who is going to give an injection to the patient who is suffering from, say, a very acute infection, knows that this injection will have a bacteriostatic or bactericidal effect. Now, how do we call it as from the motivation point of view? For example, a patient who has been in the hospital and was in the intensive care unit where all the nurses and doctors were attending, outside the relatives were attending because they were so worried that he is in ICU. Now, when he is being shifted to the intermediate care, now this particular patient becomes more sick, tries to become more sick, doesn't want to get out from this ward, because the patient knows that if he goes from this ward, he will not have so much of attention of nurses and doctors because they think that he is improving. So this is a cognitive approach. In motivation, this is called as cognitive approach. I hope this is clear to you what we talked about the theories. We'll go to the next aspect about motives. Mrs. Kalra, would you like to
we can
talk
see
about?
now the classification of motives. If we see to what are the various motives, first of all is the organic need. As Mrs. Kapoor was talking about Maslow's hierarchy, there also it was the first thing which is talked about, the physiological need. These are the organic needs like hunger, thirst. These motives drive us for the behavior. This has been already discussed in detail. Next type of motive is emergency motive. Emergency motive is to escape when environmental conditions demand for strong and quick reaction. Like recent example which we can all recall is tsunami, the destruction which is caused, the action of people at that time when they saw that something is coming and they are in danger. Water is coming, there's something coming, and people started running here and there, started looking for the higher places, or started looking for how can we help our family to overcome this. It may be more important for me to protect my own children than myself. And you start looking for. So whatever activities that are done at that moment, that is because of emergency motive within an individual. Next is the psychological motive. There we have different set of motives. Like first is security. It can be economic security, political security. Now many activities we do because we want to be secure. Like if suppose we are doing certain savings right now, we feel that the time when we are not having job, we retire, there may be pension I may be getting, but still I want to have some security that I do not have to look for others to feed me. Now many times this security need is in an anticipation of future organic need, that for my personal organic needs I don't have to depend, so I look for security need. Then is mastery. Mastery is striving for some degree of achievement, recognition, superiority and popularity. You have joined BSc nursing course because you want to be recognized that yes, you are more qualified than GNM. You want to achieve something in life, you want to improve in your skills, you want to improve in your knowledge. So, you look for, this is the mastery motivation which could be one of the motives which have driven you to join this course. Then another motive is self-esteem. Now, we all feel that we must preserve our self-respect, defense of pride and honor. These are of great importance in deciding our course of action. Now, if my colleagues have all done, I start feeling that why can't I also do? I am not less than them. If they can do, why can't I do? I am also capable. So, it is the self-esteem which motivates you for many things. Then another motive is like social motive, or these are the acquired motives. Now, they are called social motives because they are learnt in social groups like family, like the hospital where you are working. There are many things which you learn there. So, these motives are social motives. There you have, first of all, achievement motivation. People in whom the need for achievement is strong, they seek to become accomplished and improve their task performance, and these people become task oriented. That means they always look for, let me do this, even if suppose I have a staff nurse, I am assistant in charge, I must go and help. I must see that the standard of care in my unit is improved. In case there is any problem, I must go and guide the staff nurses who are working under me. So, they become more task oriented because their motive is that we must achieve certain standards of care in their unit. Then another motive under social is affiliation motive. People seek for an opportunity to be with friends and are concerned for establishing, maintaining and having good friendly relations. We all want that somebody should be close to us and we should be able to really be friendly with others. So, this is affiliation motivation which helps us to improve in our interpersonal relationship with others. Another motivation is power motivation. The expression of this motive depends on the socioeconomic status, the sex and level of maturity. Yes, I being ANS, I know what are my rights. I must see to those rights. This is a power motivation which drives you, that yes, I am responsible. Now, it is not only that I have to go and order, but I must see that I must look after their problems and help them calm, because my power is more than the sister in charge or the staff nurses who are working. Then another motive is psychosexual motive. Sex is important part of emotional life and many acts are done to satisfy these motives. The marriage which is made as a custom in all the societies, that is also to satisfy one of these needs. Then habits as motive. Our habits, they motivate our behavior. Many times we do certain activities because we are in habit. I might be going for daily walk, it has become my habit. Right? Now, when we see to the behavior of individual, it is not just one motive which drives you to the behavior. There may be complex motives, different motives that make you to do certain activities.
We have covered two major aspects of dynamics of human behavior, that is motivation and motives. Let us go to the third very important aspect, what we call it as frustration. Now, what is this frustration? Frustration refers to the blocking of behavior directed towards a goal. For example, the goal for a post-basic BSc nursing student of IGNOU is to complete her 3 years training. Now, it happens that when you are doing your training, you forget to do your registration on time. That means in September or with late fee up to October. Now, you are not able to achieve your goal of completion within 3 years and you get frustrated because of your carelessness, because of your negligence, and then you are not able to complete within limited time, that is minimum time 3 years, and then you get so frustrated that you start knocking the doors and finding out what are the ways by which you can achieve that particular goal, and ultimately you get very frustrated and you say, oh my lord, I wasted my year, and that causes a defense mechanism of either rationalization, which we'll talk in a short while, or projecting your own problem at the university, that this university is not cooperative or such and such individual is not helping me out. So those are the defense mechanism. We will talk it later, because that's the way to remain healthy, because you cannot keep on brooding over the frustration, and it is better to use some defense mechanism, overcome that problem, and you can lead the normal life. Now, what are some of the areas of frustration? One of the very common area is environment. Now, this environment could be the physical environment, it can be psychological environment. The physical environment, when you take, it can be that, for example, Mrs. Kalra was just mentioning about tsunami victims. Now, this was a frustration that water is just flowing and people cannot go anywhere. Now, this is environmental frustration, You cannot do anything you want to do. You have read enough number of cases in the paper that how a mother wanted to save both the children but could not manage because one child was very far off, could not hold, and she developed a guilt feeling. When she got the child back, the second child was saved miraculously, but still that guilt was there. But the mother was frustrated that why she could not save the second child. Now, these are environmental frustration. You cannot help it. The door is locked. You want to get out. You want to save people. There's a fire in the house, but you cannot go out. No matter how much you want to break, you cannot break open the door. And this is what is environmental frustration. Environmental frustration in the ward is that you want to provide privacy to the patient. No screens in the ward. And you cannot give privacy to the patient. The patient is dying. Other patient at night get up and they start looking what's happening to the person and feel depressed. You cannot do anything because ward has got the 6 patients in one cubicle. Even though you put the screens are not so well done because of the type of setup of the ward. So this is what is called as environmental frustration. There are personal frustration, that you want to achieve certain goals, but one should remember that set the goals which can be achieved. If you set very high goals, it becomes very difficult to achieve those goals. So the personal frustration can be that you want to have a scholastic achievement in a particular area, but because of the time at home, because of family commitment, because of job responsibility, you are not able to pay attention to those areas. Now, the good mechanism will be adapt it, adjust it. But because you want to achieve both the goals and you want to achieve this scholastic goal also, that you want to do very best in your education, it causes frustration in you. And you start having this frustration out on your family members, on your children, on colleagues, that you are not getting time, you are not getting leave. But it is good to set the goals which you can achieve. Of course, don't set your goals too low which you can achieve very easily. Set the goals according to your limitation, according to your expectations, according to your environmental situation. The frustration will be less. Then we have the competition. Now, in today's world where there is multinational companies coming up, it's very frustrating for the young boys and girls to understand 2 things at a time. They say that you have frustration also. I think we'll talk about stress, under stress also, that you have competition but also have team spirit. Now, this is a very conflicting situation. When we talk about conflict, it leads to frustration, because a competition, you know that as an individual you can compete, you can do better than your senior nurse, but still you have to maintain the protocol of the senior nurse, and senior nurse has to answer why such and such thing has happened, when you know that this may not be the answer. But if you are not asked a question, you cannot answer that, because that is the protocol, that's the line of authority which you have to maintain, which causes frustration. You also want to compete with your same level people, and you work very hard, but you are not able to compete because that particular nurse has had the training of, say, baccalaureate nursing, and you have had the GNM nursing, or now that you have had the post basic BSc nursing, she is also post basic BSc nursing, and this sort of competition, that let me show that I am better than you. Now, this causes frustration. Affiliation, I think we have talked enough about the affiliation, that sometimes when you make extra effort to get affiliated to certain people and you are not able to have that affiliation, it causes frustration. For example, you want to be closer to the ward sister for various reasons. Not that you want to take benefit of day off, but it can be that you can see that the drugs are given on time, patient care is improved, but that is mistaken, that is taken in a wrong sense. But this affiliation, when you are not able to achieve, also causes frustration in the individual. Let's go to some of the reaction to frustration. When people are frustrated, Mrs. Kalra, what are some of the common reactions shown?
See, when the people are frustrated, first thing is that you try to have direct approach. Direct approaches, there are three things in it. One is that you increase your efforts. You are not able to achieve good marks, you start putting in more heart, and you see that you are able to score better marks in your next test. Another one is variation in mode of attack. I am not able to score better marks, maybe that I am not able to take out much time for studies. So let me think of that if I am not able to get out much time for my studies, should I take some leave and start working more hard, taking leave, sitting at home? Or it may be the change in goal which may be required, that I need not get frustrated because my motive was to get 80% marks. If within my limited circumstances I have to look after my job, I have to look after my family is also a priority for me. So let me look for that, let me not score 80, let me have my target as 70%, which I can easily achieve. Then another way of reaction to frustration is feeling of inferiority. If you are not able to achieve, most of the people, they start feeling that it is that I am becoming very low scorer in my class. I am not able to achieve. Why did I join BSc? It was much better. Now I cannot compete with others. Now it is very important that one must look for other approaches instead of started looking for having this inferiority complex. Then another way which people react is aggressive behavior. Many times you find that you are not able to do well, you go back home and you start shouting at children. You start taking out anger at different places. Why? Because it is your internal need that you are not able to satisfy. Then, as Mrs. Kapoor was mentioning, there are various mental mechanisms which a person start using. We'll just go to these mental mechanisms, but one of the ways that if there is frustration, person may start developing certain mental symptoms. It may be some neurotic symptoms or psychotic symptoms. Like, as you said, the child has developed fear. The child doesn't want to go to school. Child says, I cannot be going to school. Child starts showing fever. Now, these are all the symptoms which are developing because of the feeling of frustration, because of the feeling that I'll not be able to cope up with the stress.
And this is called as somatoform kind of a symptoms. That means bodily symptoms are being shown by the child who has gone through the psychological stress, through the psychological fear which he or she has gone through. The incurable disease is again a cause of frustration, and definitely I think as a nurse you can really do the counseling. The frustration is there. In the beginning the patient thinks my world is finished. I cannot do anything. Maybe HIV AIDS, certain diseases where the person finds that he is suffering from a leukemia, or cancer which is a malignant type. Now for that, as the days pass, the person starts coping with it and wants to find out, sister, how many days am I going to live? What should I do? Now you can tell this patient to make your needs written down, positive approaches to your life, you can write it down, and it is not the days, it's the quality of life which is going to matter. That's what you can be talking about in incurable diseases. Now the solution, finding solution has to be from the patient, but you have to give him a platform to talk about it, to let him ventilate, to have the emotional catharsis, verbal catharsis, and that makes a person light, and that will help the patient to try to understand, and maybe mind will be more clear, less frustration over a period of time, and person will be able to sort of adapt and adjust to the changes which are there. So I think this is what is very important. Now let us summarize what we have talked about this particular course and particular topic about dynamic of human behavior. We mentioned what is motivation, what are the different characteristics of motivation, and how the person have a important motivated behavior. What are some of the theories? How do you differentiate from need, drive and motives? We also talked about the frustration, types of frustration, and how one can overcome the frustration. There is another important element is defense mechanism, and with this I would like to thank Mrs. Kalra for having discussed in a very simple manner, and I am sure students have enjoyed and understood it. Thank you very much.